Hi everyone, I'm going to do a recording for prescription writing because I don't think I will have time to go over it in lecture. These are the objectives for the prescription writing PowerPoint. So a dental hygienist under the supervision of a dentist may prescribe, administer, and dispense fluoride, fluoride varnish, antimicrobial solution for mouth rinsing, or other non-systemic antimicrobial agents. So this is really important for us to understand our prescriptive power as dental hygienists in Oregon. If we have an expanded practice license, which all of you will hopefully get and you'll be qualified to get when you graduate, then you also have the additional ability to prescribe prophylactic antibiotics, NSAIDs, which is like, non-steroidal anti-inflammatory, so like a prescription strength ibuprofen, local anesthetic, and all applications of fluoride. So that's the additional prescriptive authority that you have in Oregon. And that is very unique. It is a very unique ability that hygienists in Oregon have to prescribe antibiotics. Of course, it's only for one purpose, but still, to have that ability is really pretty cool. So the parts of a prescription, we have the heading here that has it has a DEA number of the dentist. Of course, we don't have DEA numbers, but there's information up here. There's the doctor's license or the hygienist's name and license and their address, patient's name and address, age and date, and then we have the body of the prescription, which has the medication and all the dispensing information and how to take it, and then we have the closing and the signature down here at the bottom, how many refills and that sort of thing. So like I said in the previous slide, the parts of the prescription are the heading, which has the dental business, name of the business, address, phone number, patient name, address, age, date of birth, prescriber's information, DEA number, and then the date. Then the body is going to have the medication name and the amount, so milligrams, ounces, grams, that sort of thing. The DIS, which is how many, and then the SIG, which is instructions for use. And then in the closing, that's going to talk about the number of refills, instruction like dispense as written, meaning no generic substitution, or generic brand drug name dispensed. So you may notice the DEA number area in the top of the prescription, and you might wonder, what is that for, or what does the DEA number stand for? Well, DEA is Drug Enforcement Agency, but the DEA number stands for Drug Enforcement Administration. And so that's a different, slightly different than the Drug Enforcement Agency, but it's very similar. So DEA number is Drug Enforcement Administrative Number. And that basically just tracks the controlled substances, how often doctors prescribe controlled substances. So there is a schedule that has to do with abuse potential, and then these are some examples. So we have C1, remember that as the highest abuse potential, no safe medical use. Ironically, marijuana has been on that for some time, and that's mostly political because we know there are safe medical uses for marijuana. But PCP, LSD, and heroin are all examples of C1. C2 is the next highest, and it has some safe medical uses: morphine, methadone, oxycodone, and Ritalin. These are all highly, highly addictive, very dangerous in high doses, but they use them quite often for pain control and other reasons as well. C3, moderate, acetaminophen with codeine, acetaminophen with oxycodone. C4, low, triazolam, Valium, Xanax. These are all given for anxiety and possibly for other things as well, but anxiety is very common. And then C5, which is the lowest cough medicine that contains codeine. So does a dental hygienist have a DEA number? I'll let you think about that for just a second. The answer is no, we don't, because we can't prescribe controlled substances. However, a dental hygienist can apply for what's called a national provider number or an NPI number, and you all should do this after graduation. So the NPI number is a unique 10-digit number issued by the National Plan and Provider Enumeration System. The NPI number replaced the DEA number as identifier, and it's transitioned to NPI mandated by HIPAA. So it's really very important that all healthcare providers apply for their NPI number. It's very quick and easy. You just go to this site here. Let's see what we have on the next slide, and you just pop in your information. So they need your name, social security number, date of birth, all the things you can imagine that the government might want in order to track you as a healthcare provider. And then this is the one thing that some people get confused about, the taxonomy, provider type. They might say, well, what in the world is that? I have no idea. Well, the taxonomy code for dental hygienists is right here, and you can find it when you look under the different providers, but it's just nice to not have to go searching for it. It's this down here at the bottom, 124Q00000X. And then you just put in some contact information and you get your NPI number. So writing the SIG, so all of these abbreviations may seem kind of strange and don't seem to make a lot of sense when you first look at them, but that's because they're Latin abbreviations. So SIG is right on the label, so that's writing the instructions basically. And so when we go through all of these, we need to become familiar with what they mean. So it's important for, I would say, write these down on flashcards and sort of go through them. Some are going to be a little bit more sort of intuitive, like TAB tablets. Let's see, what ml, milliliters, PM, afternoon, that kind of makes some sense, right? And then AM, morning, so that makes sense. Things like twice a day, BID, or PO, orally, by mouth, TID, 3 times a day. Those are some things that you're really going to want to commit to memory. QID, 4 times a day. And then, where's the once a day? QD, every day. PRN, as needed. That's a very, and DIS, dispense. So really all of these are ones that you're going to want to become very familiar with. Before meals, after meals, all those sorts of things. Take 1 hour, before appointment. You got to have to be familiar with how to write that up with these common Latin abbreviations. Okay, so now we're going to look at some prescriptions, the way they're written out. So just make sure I'm not. Okay. So here we have they can look different ways, and nowadays a lot of times a prescription will be done on the computer and then printed off, and either you sign it or the doctor will sign it. So prescriptions can look different than like a pad that, it used to be that it was like a pad of prescriptions that you would just fill in, but now a lot of times we type it out on the computer. But there'll be the heading, the doctor's information, and then the patient's information. And then this one is for sodium fluoride. So it's sodium fluoride, 1.1 milligrams, and they're dispensing 120 tablets. And the instructions is to chew and dissolve 1 tablet in the mouth, then swallow once per day, preferably before bedtime after brushing. So this would be for a kid who's on supplemental fluoride because maybe they don't drink fluoridated water, they're on well water, something like that. So here's the ADA's recommendation for supplemental fluoride and the dosage. So between, and you will probably learn this in cardiology as well, I believe, but if they're between 6 months to 3 years, so under 6 months they don't recommend fluoride, supplemental fluoride, but 6 months to 3 years, concentration of fluoride ion in the drinking water. If there's less than 0.03 parts per million in the drinking water, then they would get 0.25 milligrams. If there's somewhere between 0.03 and 0.06 parts per million fluoride in the drinking water, they don't need supplemental, and anything above 0.06 for any age group, they don't need supplemental. If they're 3 to 6 years old, they can have a 0.5 milligram or 1/4 milligram depending on how much fluoride's in the drinking water, and then 6 to 16 up to 1 milligram or 0.5 milligram depending on how much fluoride is in the drinking water. So this is the asterisk is fluoride content in water, which is, and they'd have to get their water tested. So they'd have to go to the city if they're like out of city limits or something, out on a farm, or just have well water or something. They'd have to go somewhere to have their water tested to see if it has fluoride in it. So fluoride equivalent, so 1.1 milligram of sodium fluoride is equal to 0.5 milligrams of fluoride. 2.2 milligrams of sodium fluoride is equal to 1 milligram, and 1.1% sodium fluoride is equal to 5% fluoride. So there's some conversion tables for you. I have not had a lot of patients who were on a fluoride tablet because I live in Scappoose and they have fluoridated water. But if you work in Portland or Hillsborough, Beaverton, you may end up seeing this more often. So here's another example of another prescription, nutrisodium fluoride gel or toothpaste, 5,000 parts per million. So this is a prescription fluoride toothpaste. It's a 2-ounce tube, and then the instructions are to brush on teeth if paste, or place teaspoon of gel in a tray. Oh, I see. So either brush with a tiny bit or place it in a tray depending on how it's being dispensed, and apply to teeth for 3 to 5 minutes once per day. Now this could potentially say something like don't rinse, preferably right before bed, no rinsing, something. You could put other instructions, or you could just tell your patient that, maybe have an instruction pamphlet that you hand to them along with the prescription. For an antimicrobial rinse such as chlorhexidine, oral rinse 0.12%, dispense 3 16-ounce bottles, swish with a 1/2 ounce for 30 seconds twice per day. That's an example of what a prescription might look like for chlorhexidine. And then pre-medication, antibiotic pre-medication, if they're not allergic to penicillin, the most commonly recommended antibiotic is amoxicillin if they have no penicillin allergy. And I don't know why this says dispense 5, because the typical amount, I could be wrong, but I'm not going to double check it, but I thought that, pretty sure the typical amount is 2 grams, which means they take 4 tabs. Yeah, take 4 tabs by mouth 1 hour prior to dental visit. So I don't know why they're dispensing 5. I feel like that's a typo. And then 1 refill. Oftentimes when someone has something for pre-medication, there'll be a couple refills, just so it's something fairly regular. Every time they come in, they know they're going to have to do it, so they'd like to have 1 or 2 refills. They used to say follow up with an extra pill afterwards. That might be why the 5 is there. I don't know, but they don't do that anymore. They just, anyone who really needs to take the pre-med, they just take the 2 grams 1 hour before the dental visit. And clindamycin, if they have a penicillin allergy, is the next antibiotic of choice, and that is 600 milligrams. So they're 150 milligram tablets. They take 4 of them to equal the 600 1 hour prior to the dental treatment. So we're not going to practice. I'm not going to go over these. Maybe, hopefully, we'll have time to talk through these in the actual class. So that's it for this one.